So welcome, everyone, and thank you for joining us for this roundtable discussion. And the purpose is really highlighting innovative approaches in cardiovascular health. My name is Dr. James Blassetto, and I am the chairman of the board of the AstraZeneca Healthcare Foundation. Now, as part of today's discussion, we have representatives from the West Virginia Health Right and St. Mary's Health Wagon, both of whom received grant awards from the foundation for their innovative community-based programs that are tailored to the approaches that work best within your community. So let me set the stage for this. Cardiovascular disease is still a leading cause of death in the United States. And the American Heart Association, has reported that over 85 million adults are afflicted by cardiovascular disease. As a cardiologist, and I think that all of you can feel the same way, this is an alarming statistic. And this has real human and economic costs that we can no longer afford to bear. That's why, we feel like programs like what's being performed by the West Virginia Health Right and St. Mary's Health Wagon are so important to eradicating cardiovascular disease. Now, as chairman of the AstraZeneca Healthcare Foundation, I am proud to see this kind of collaboration between public and private organizations, patient advocates, to address this critical healthcare problem. Now, as a little bit of a background, to date, we've had over 51,000 people across the country participate in a variety of community-funded programs. And these programs are occurring in neighborhoods, in community centers, in schools, and in clinics. But each of these programs has the same goal. And that goal is to engage and educate individuals about cardiovascular disease, and at the same time to encourage better behaviors, changes in lifestyle. And what I can say so far from the programs that we funded, again, we are seeing these results. We are seeing people that are making changes. And you'll hear some of the stories today. But people are eating better. They're losing weight. There's improvement in blood pressure. And there's better understanding of cardiovascular disease and the risk factors for cardiovascular disease. And the AstraZeneca Healthcare Foundation believes that by supporting these organizations, we can make a real, measurable, and meaningful difference for people and communities throughout the country. But we also think that by providing a forum where we can help these groups talk about what their programs are about, lessons learned, what is working well, that we can expand the reach of the individual programs. And that's why we're here today, not only to recognize the great work that is being done by these two organizations, but to have a discussion, talk about their approaches, talk about what their program is doing, lessons learned, so we can have a better understanding of exactly how things are going. And we hope by posting this information that other organizations can benefit from this information as they're on their journey to improve cardiovascular health within their community. So to help us facilitate the roundtable discussion today, it is a pleasure that we are joined by Dr. Daniel Foster, a former West Virginia State Senator, who I know, and we've talked over the years, several years we've been here. He has worked tirelessly to promote the health and well-being of West Virginia citizens. So, Dr. Foster, I'm going to ask you to come up to the podium and kick this off. Thank you very much.
Thank you. Thank you very much, Dr. Blassetto, and for the kind introduction, as well as for your fellow trustee, Dr. Newby, for joining us today and for presenting these checks, which were much appreciated. I know it kind of reminded me of my wife one time a few years ago. Wanted to, said we needed some money. She wanted a big check. So I went out and purchased a large check for $75 and gave it to her. She was very pleased. This is far more significant. I'm honored to serve as your moderator today and on this very important issue that has a devastating impact on the people in our states. And in full disclosure, I need to acknowledge that I'm actually a cardiovascular survivor. It's been almost 12 years ago that I had a heart attack and had emergency quadruple bypass surgery. And so I understand the need for prevention and the need for these resources. According to the CDC, heart disease accounts for 23% of all deaths in West Virginia and 22% of all deaths in Virginia. That is significant. These alarming statistics are coupled with a lack of access in health professionals, facilities, and insurance. Although that's improved some, it's still a problem, which amplifies the health disparities and challenges that these communities face. But the two programs we're highlighting today are looking to change that and have already changed it in many ways. St. Mary's Health Wagon's Heart Health 123 Comprehensive Cardiovascular Disease Initiative for Diabetes mellitus, metabolic syndrome, and obesity identifies, minimizes, and prevents cardiovascular disease in individuals with metabolic syndrome, diagnosed as dysmetabolic syndrome X, diabetes, and non-alcoholic fatty liver disease through health education, screening, and medication management using a holistic medical approach and evidence-based practices, which are becoming more and more important these days. Joining us from St. Mary's Health Wagon on our esteemed panel, whom you've already met, are Dr. Teresa Gardner, who's the Executive Director, and Dr. Paula Hill-Mead, who's the Clinical Director. The other featured program that you've already heard about is from West Virginia Health Right, which of course is hosting us today. The group's SCALE program, which stands for Sustainable Changes in Lifestyle Enhancement. The program aims to achieve through personal coaching, group support, nutrition education, improved diet, and regular exercise, sustained weight loss in 100 obese patients to improve their health status and reduce cardiovascular risk. Joining us from West Virginia Health Right are Dr. Angie Settle, who's the CEO and Executive Director, and of course Dr. Rahul Gupta, who's, in addition to being the Commissioner of West Virginia Bureau of Public Health, is also a West Virginia Health Right volunteer. We have an hour, and I'll do my best to try to get through most of this in an efficient way to glean as much information as we can about these programs and about ideas that I think are spreading around the country for dealing with these various problems. The burden of cardiovascular disease, innovative approaches to fight cardiovascular disease, lessons learned from implementing these programs here, and as well as the impact of the AstraZeneca Healthcare Foundation support. So bear with me as we try to be efficient and get the information that we need in order to face these challenges going forward. What I have are a few what I think are pertinent questions, and I will address these to those involved, and Dr. Bossetto and possibly Dr. Newby may chime in at the end of each individual topic. First question. We've already noticed some of the alarming statistics related to cardiovascular disease in West Virginia and Virginia. With this in mind, what are the biggest challenges your community faces with cardiovascular disease? And I'll ask Dr. Gupta and Dr. first, and then Dr. Gardner to comment on those.
Sure. Thank you, Dr. Foster, for that. I think when it comes, what it comes down to is, it's been mentioned, it's the challenges of Appalachia and regards to not just cardiovascular but a host of diseases. But when you look at the burden and where we're going with that, it bottom line comes down to a couple of really factors, which is a lot more lifestyle behavioral today. As opposed to 100 years ago, where the majority of reasons for mortality and morbidity were communicable diseases, those today are mostly lifestyle. What that means is that whether it's the cancers, the cardiovascular disease, and the other host of diseases, the causative problems there comes back to basically obesity and tobacco and the illnesses originating from those. We feel the challenge in Appalachia, of course, is that it's difficult, not just because of the geography, the linkages between education, literacy, as well as poverty. And the challenge there is, how do we develop those innovative solutions? And that's where both HealthRight and the Health Wagon are critical to develop those innovative approaches to be able to maximize and basically enlarge into larger projects. Do want to recognize we have our Jessica Wright, our Office Director of Health Promotions, as well as Tia Williams, who's from the Office of Minority Health. We take it seriously. One of the things we have done recently, almost for the first time ever, we are developing a state health improvement plan, and that actually has 3 buckets. Includes obesity, tobacco, and substance abuse. So there's a sort of almost a deliberate effort statewide to be able to take those challenges and develop evidence-based solutions to our problems that we lead in the nation, unfortunately.
Thank you. Dr. Gardner?
The biggest challenges that we see at the Health Wagon is lack of access to primary, preventative, and specialty care, in addition to the factors that you said that contributed here in West Virginia. The communities in Southwest Virginia, it's all built around coal, and coal has been severely diminished, and there has been no sustainable replacement, in the economy. And although the Health Wagon, we are a mobile clinic, we have 2 stationary clinics as well. We've always focused on treating the uninsured and the underinsured. However, we're seeing people that have had insurance all their lives and now are faced without any insurance or resources for that. And in Virginia is one of the wealthier states in the country, but there is such disparity between the Eastern Shore and the mountains of Southwest Virginia. And we often, like when we do presentations, we'll have a PowerPoint slide that shows the disparities that goes across the counties, and the counties out on the Eastern Shore. They have low rates of mortality and morbidity, but then they just it's almost like off the chart. They escalate when you get into the mountainous counties of where we're at in the coal counties of southwestern Virginia. So it's just the health disparities that exist. We're trying to alleviate some of that burden with the AstraZeneca Healthcare Foundation grants and get access out there to our patients.
Thank you. I also would comment that I'm a product of Appalachia. Certainly Charleston's my home now, but I grew up in East Tennessee, not far, and actually some of those citizens are serviced by St. Mary's Health Wagon, and so it's particularly compelling for me to hear from these 2 groups. Dr. Placedo?
Yeah, just, it is, we have seen great success, with, creating access for patients, albeit, brick and mortar or with the mobile units. It is interesting that the concept of bringing the care to the patients that the Health Wagon is utilized. And we've seen that in other programs, and even in inner city programs where there may not be a large distance, but there's still that inability to have access to care, and bringing the care or bringing the program and the education to the to the participants. So, again, I think that speaks to, what is the need, what is the important approach that we need to take as a group to get this information out to the, to the participants.
Thank you very much. Moving on, our next question is, what gaps or unmet needs do you hope to address through your programs? And again, this time I'll go to Dr. Gardner first.
Okay. Certainly with this program, we've increased screening. I mean, we screen everybody that comes through our clinic, and last year we had 9,000, we're close to 9,000 patient encounters, and that this number just keeps on escalating, and we're always faced with, just how much more can we do, how many more patients can we take? We're already overloaded, but we have also outreaches. We have health fairs that we get out and screen. We're very involved in the community. We do that multiple times a year. And then we also host Remote Area Medical, which is the largest medical outreach in the United States. It's a 3-day weekend where we provide free dental medical care. But again, when 2,500 to 3,000 patients come through that weekend, we're screening everybody for cardiovascular disease, and so we're really getting out there and untapping a lot of disease burden that has not been uncovered in the community. I mean, they'll come to these clinics and they don't know that they have diabetes, they don't know that they have hypertension, they don't know that they have, high lipids. And so just by really getting out there in the community and enticing the patients to come in the community, we are so focused on outreach, and it has paid off really successful. And then we're able to get those patients into the clinic, and get them into a treatment plan of care. And these patients are faced with, we're the only option that are in far Southwest Virginia with patients without insurance.
Thank
And
you.
we also look at, overall improving the outcomes and reducing cardiovascular events by getting out in the community and reaching these patients to change their lives for the better.
It's a lot of outreach, for sure.
When I come in and I see a patient that looks like needs the help, I think it is these programs that are tremendous but also critical to the success of that individual patient in the ability to lose weight, lower their cholesterol, lower their obviously BMI, but also get the host of help and other avenues that they need. And how effective is that long term? Talk about return on investment from a dollars and cents perspective, in addition to the health part of it. Reduces hospitalizations. You will be amazed to know that there was some work done with Dr. Foster, myself, and a number of other folks here in the community of the task force, and we found that as opposed to the traditional thinking that people who typically are uninsured tend to go to the emergency rooms more, that was not the case, actually. And it goes back to the ability for those people to have preventive care, be able to have healthy lifestyles and move on through this program that helps. On a bigger perspective, I do believe exactly what Dr. Blasetto said is I think from a brick and mortar, there is a transition happening, which is whether it's mobile clinics or it's telemedicine or other ways to get to the people where communities live, because that is the larger public health challenge that we face today and that's in a lot of places, which both the Health Right Clinic here does as well as the St. Mary's Health Wagon, is to reach population that would otherwise not be able to be reached and make that impact on life.
Thank you very much. Any comments?
Two things. One is a question back to the group around, getting the information out or trying to acquire the information. And we were talking a little bit about it earlier today, is the role of social media. We've heard in some areas, in some populations, social media isn't as widespread, but I got the sense that, it's a good tool and it's something that's being utilized. So I'd just like to hear your thoughts on that and how you guys are utilizing those capabilities.
Yeah, absolutely. I totally agree with you, especially in some of the mountainous regions. You'd be surprised. A lot of people have a cell phone. They can access Twitter and Facebook, so it's just vital. I try not to get into the minutia details, but, occasionally, I'll check our Twitter and Facebook and say we need to tweet that. We need to put something out there about this event. We need to say something about the SCALE program, say something about our smoking cessation program. Any way you can get the word out there, it's so important. So I do think it's ideal that we do that, and we try to stay on top of that here at Health Right.
Great. Thank you. Moving on. Next question is, what innovative approaches will you use to help fight cardiovascular disease in West Virginia and Virginia? Dr. Hillmead, why don't you lead off for us?
As we are a mobile health clinic, this is how we actually give our care. So the AstraZeneca grant has allowed us to expand our health outreaches, our screenings, and we are just the terrain here, the geographical area here in Charleston. That's what we have in extreme Southwest Virginia. However, you are fortunate here with Charleston as you are more of an urban area. We are so rural there. And when you're talking about as the crows fly 20 miles in our mountainous terrain, you're looking at least an hour's drive to get to a healthcare provider. We, as nurse-managed clinic, take the care directly to the people. Teresa is a family nurse practitioner, and I am myself, and we still provide hands-on care. And as I said, we've been able to increase their knowledge. Using that mobile van takes it not only actually to their doorstep, and we do have one patient that actually walks to our mobile van. She walks over a mile, because when you're looking at the area here, we don't have a public transportation system, especially when you're going to another county. And our clinical sites are at Dickinson County and Wise County. We do have 2 stationary sites, but without that mobile van, they can't get to the doctor. A specialist is an hour and a half away. We actually take our specialist right to the patient on the van. We also take Appalachia College of Pharmacy. We have a pharmacist and pharmacy students that we take. As soon as they come on the bus, we start screening them. As Teresa said, every patient that comes through for cardiovascular disease, a lot of this is making them aware of even what dysmetabolic syndrome means. Meaning, if they have 3 of the 5 symptoms, including you have abdominal girth increase, you have an increased BMI, your triglycerides are this level, your blood sugars are high, your blood pressure is high, but they haven't put together that having 3 of those puts you at an increased risk for a cardiovascular event. So that's the innovative approach we are, is going right to the people, going into churches. We have some churches that we take right there. We go to the grocery stores. We screen them as they're going into the grocery stores when we're giving their flu shots. We screen them as they're leaving their pharmacists. So we're actually involving community all the way around.
Thank you.
Thank you.
Angie?
Well, first of all, I'd like to say I want a wagon. The whole time she's talking, my mind's just spinning. I mean, we are fortunate to have an urban type setting, but we do reach every county in West Virginia. We've been able through this program to have some funding to provide like gas cards, bus passes, et cetera, to help bring those people in. We know it's a challenge just getting here, the transportation. We're encouraging them to come back, and they'll say, well, only have gas to go to Charleston one time this month, so we're able to help with that. That's important. What's innovative and different about this program is the personal coaching, which it's one-on-one, it's peer-to-peer counseling is the other issue. We have somebody that's lost weight, they come back, they're a patient, they talk to the class and teach everybody what they went through. That part's very effective. Screening every patient, every visit for the program, so it's not an afterthought. It's part of the front desk. We actually have a lady stationed at a desk in our waiting room, and her job all day long, she's a volunteer, is to just approach patients to see if they'll join the SCALE program. So it's not an afterthought. It's something that we do all the time. Another important factor that's different about our program is in the past 6 months I've had a dream, and it's actually came to fruition, is the integration of a behavioral health component of our program, because we all know that our state, leads the nation in addiction, so we are addressing that issue. But also as a component of that is the aspect of food addiction. So we've actually, tied that into the classes, and that's one of the classes that we offer too. Last thing I want to say real quickly is it's so important to be culturally sensitive in our area. I'm proud to be a born and raised West Virginian. My patients are not going to eat tofu. It's just never going to happen. So one part that we put into this program is to actually have them relate to us, look at the barriers. 2 of the staff members that are teaching the smoking cessation, I approached them, said, you would be great to teach this class. How about you stop smoking? So I worked with them. They both stopped smoking, and now they're perfect to turn around and teach that class. I've had 6 kids. I felt so guilty last year. I'm like, gosh, I got to lose weight. I'm up here talking about this. I still have a lot ways to go, but I lost 35 pounds. So I was one of the first people to get up in front of the class as the CEO, whittled the time out and taught the first waist watchers, let's be clear, not Weight Watchers, waist watchers, don't want to get in trouble, class to get in front of the patients and say, hey, I'm the CEO here at HealthRight, and I need to lose weight, and I'm with you, and I don't want to exercise, and I'm busy, and I have 6 kids. And, the response that you got from that, there were so many people, the attendance quadrupled. Just thinking like they think, okay, what would I do? What's important for them to know? Okay, I have to eat out at a fast food restaurant. Let's list every restaurant that they possibly could go to and tell them the healthiest thing that they could pick. So they can't say, hey, I can't eat healthy. So just the little things, week to week, we build on that. I've turned it over to the nurse educator, but I think it's so important for them to know that you relate, that the uninsured and underinsured face problems, more affluent, middle income, it's all the same, and making it individualized. Asking them, what's your barrier? What's stopping you from losing weight? And then curtailing the program to that person.
We're hearing about the future of healthcare here today, chronic disease management, population health. These groups are clearly at the cutting edge and will be models for other health systems and other organizations that are beginning this long journey. So it's just great to hear this information, for sure. Dr. Bocetto?
Yeah, just one point around coaching and peer-to-peer interaction that you guys are utilizing. And, we've seen that in a variety of programs where that the importance of a peer-to-peer interaction can't be, is clearly can't be understated, because people, it's one thing for, as a professor to come in and talk to someone, but it's something else when someone who they know, or a community person, or someone that has gone through the problem, comes in and actually brings it home. And we've seen some very, very good results utilizing that type of approach, where, again, it's a peer-to-peer interaction or a coaching type thing with someone from the community, or a volunteer type of thing. So again, as far as, tools of innovation, that one is, is a great example of where we're seeing, success.
So the other thing I would add to that, which I think was so true in what you said, is that many of these problems are common to everyone. The innovation comes in, how do you deliver the education, the information, the peer-to-peer at a way that it relates to the circumstances that individual is dealing with. And that's the part that's not common. So I think what you described there is exactly the crux of it. How do we address common problems in unique and tailored ways to the individuals in front of us?
That's where the personal coaching is really important. If you don't have one-on-one and you're standing and talking to a class, you may hit something that applies to them, and you may not. But if you're one-on-one and you meet with them and say, what's your barriers, then you can work with them, and it outcomes so much better that way.
Thank you. You all obviously don't work in a vacuum in the way you structure your outreach. And so the next question is, how are you working with community partners to implement these approaches? Angie?
Well, in case you didn't hear me say kitchen 22 times today, I'm going to say it again.
By the way, we want her kitchen.
She wants. I want her wagon. We're going to trade. When I took over as CEO about a year and a half ago, one of the visions that I had, having been at Health Rate almost 20 years, I'm a nurse practitioner by trade too, and worked in different aspects of the clinic. So I know, boots on the ground, what we need. It's one thing, we've tried to do classes, we bring in hot plates into the educational room, pre-prepare things, here's how you do it, here, huddle around. I said, would it not be just fabulous to have a teaching kitchen? Big open space in the education room, flip it sideways, everybody faces this way, the person's up there, she's talking, come on up, or he, come on up, let's cook, chefs from the community, nutritionist. And I'm so happy, the Charleston Rotary Club came to me about 6 months ago and said, do you have a project, that would help women in cardiovascular health? And I'm like, I got a project that'll help women, children, their families, men, everybody. So luckily they took that project on, and construction ended today on that teaching kitchen. So we're so excited about that. Yeah, so excited. But our partnerships are endless. Like I said, chefs from the community, medical students. We have pharmacists, faculty, and students coming over from the University of Charleston that are participating, doing classes. We have a lot of community partners like the United Way, Charleston Area Medical Center, Sisters of St. Joe's, local fresh food markets that are so important. I mean, the list is endless. It really is. That, what helps us do what we do here at Health Rate.
Thank you. Dr. Hillmead? Or which?
Either one, we can go. We actually are, we feel like one of our strengths is, and Teresa's really good at this too, is the networking and collaborative approach that we take with the community partners, Appalachia College of Pharmacy, the Lions Club, Remote Area Medical, Stan Brock. Who have we not collaborated with, Teresa? And you can kind of finish this.
I mean, God has blessed us with unprecedented community collaboration, and I think that's the key to the success of any program. At our RAM event, our 3-day event that I was telling you with free eye dental medical care that we have each summer, we have over 200 plus organizations participating. We've actually got so many that it's even hard to count. And we'll have over 1,400 volunteers. We have to even limit our volunteers. There's so many that want to come. And most of those are medical, you know, they're dentists or dental hygienists or cardiologists. We've got a whole host of medical, eye, dental, and the list just goes on and on. So we just have unprecedented community collaboration. If there's a resource out there, we try to tap it. I mean, I was getting resources from Angie today, and going back to her kitchen though, I told one of her board members, I said, we're taking that kitchen home in that Ford Explorer, and he said, I don't think you can fit it. I said, we're traveling with 5 women. I said, we know how to pack. We will get that kitchen in that Ford Explorer.
Let me add too, this total oversight on my part, the most important thing that we have at Health Rate is our volunteers. I mean, they are like the total backbone foundation, and our board. We have a great board of directors that's very collaborative, you know, medical specialists, different professionals in the community. So they have a lot of support. They spend a lot of time here. But the 400 plus medical and dental volunteers that come here, not one physician or dentist that comes to our clinic is paid. They all volunteer their time. And I describe it as a quilt of care because they'll come like one day a month for 2 or 3 hours, that physician, another physician, and with that, you're able to cover the clinic schedule and provide that care. Without them, we would not be here, absolutely.
Well, collaboration is the key, and I'm sure that also helps leverage philanthropic support with that additional connection that's what a lot of these funders are looking for, and I'm sure that's no exception with the AstraZeneca Foundation. So,
Yeah, the key here is, you know, cardiovascular disease is still a major problem in our country, and it's not something that we're going to be able to eradicate in 1 day or 2 days or 1 month. I mean, this is an ongoing problem that we need to reel in all the resources that we can, keep these programs going year on, so that we can continue to do what works well in your community, but don't stop it today and don't stop it tomorrow, and just tap into resources. And again, that's part of the innovation of each one of these programs. Like, what is the right thing for your community? Who are the right touch points that you have that to bring that and bring it into your into the great work that you're doing. And I will say it is a nice kitchen.
We'll trade. I'll take your wagon.
it's my role to keep things moving along. We could talk about that kitchen for a while, I'm sure. What impact have you seen from these approaches? And I'll ask first Dr. Gardner.
I think that we've seen that our patients are more compliant. They keep their appointments, and certainly, the positive health outcomes. Our health outcomes with our project is that we've had our average blood pressure. First of all, we're all electronically. We have electronic health systems, so we can track our data really good. Our average blood pressure is 128/76 for our patients. We have 53% of our patients have had a decrease of blood pressure, 41% of patients have lower cholesterol, and 22% of our patients, which is phenomenal, have lost 10 pounds or more, because if you've ever tried to lose 10 pounds, that's pretty hard. And so we're very proud of our results. And even like for our diabetic patients, with the programs that we've had from AstraZeneca, hemoglobin A1C is like a 3-month blood sugar that gives you the 3 months blood sugar on it. We would put that hemoglobin A1C up against anybody in this nation at 7.1, and that's because we work at removing all the barriers for those diabetics. We get them in with the endocrinologist, we give them their glucometers, we make sure that they get their medications, we get them their education, we just really optimize everything about that treatment plan, And we have such success in our clinic. And being in an uninsured area where we've got low literacy rates and lack of transportation and all these different barriers, we should not be having that success. But when we remove these barriers for these patients, we have phenomenal clinical results.
And our two patients here are just our shining billboards.
Yes.
They're twins. They have lost 100 pounds through this program each. So they have came off insulin. And really, without the AstraZeneca program and foundation, they may not have been here because their life has been, we have definitely improved their life, and we're just so thankful for them. They now motivate us. So we're very thankful.
Yes, the AstraZeneca Healthcare Foundation is saving lives, and that's two examples that we brought with us, and these patients can be multiplied many times over at our clinic.
Well, we'll get to hear from them later.
Yes.
A picture's worth 1,000 words, as we'll soon learn. Angie?
Yeah, I just want to talk to you about some of our results. This is pretty exciting. 100% of our patients have lost weight. The aggregate weight loss is almost 1,000 pounds. Oh, my gosh. Yeah, that's amazing. The average weight loss per participant is about 20 pounds. And I didn't put myself in there with any of that. It might have been me. 80% drop in hospital usage of these patients. So this goes to show you, you change one factor, it's a trickle-down effect. They lose weight, they improve their hemoglobin A1C, their sugar, they improve their blood pressure, they feel better, they're out, they're active. This is so important. Also, 92% of the patients are now engaging in physical activity. That's huge for our area. It really, really is. 100% of the patients, and we did this through pre-test, post-test, are preparing and eating healthier foods on a regular basis. That's huge. I mean, you know, we like our biscuits and gravy here in West Virginia. We like chicken and dumplings. We like it Grandma's way. So the big thing for us is not trying to change who they are, not trying to make them eat things that they will never eat, like tofu, but to take the recipe. I tell my girls, take something that they like, tweak it, make it healthy, make it palatable, make it fun. And it's important that it's interactive, too. That's really made a huge change with us, that it's not me talking down to you, telling you what to do. It's how can I help you and how are we going to do it together.
Thank you. Well, you obviously have learned a lot. And what I'm going to try to do is move on through some of these, because our time is departing quickly, and I want to make sure we get to some of the more important aspects of this. What are best practices, or what best practices would you share with other communities that are working to improve cardiovascular health? Angie?
Well, I think, the repetitive, but, it's the peer-to-peer, personal coaching, individualized, culturally sensitive. I can't express that enough in our area. I mean, I hate to say it, but if I go into class, with my little accent and I'm talking to them, they get it. If somebody would come in, from, Northeast, New York, they're just going to be like, huh? They need to know that you understand their problems, that you've been there. That's the other important fact of actually living, breathing somebody that's lost weight, needed to lose weight, somebody that's smoked. I've never smoked a day in my life. And to go in there and try to feel their pain of smoking, it's just not there. So that's why it not only helped my staff, motivate my staff to quit smoking, and me saying, you'd be great for that. What if you quit smoking? You could turn around, you could say, hey, I've been there, you know exactly what to do. So I think it's so important, peer-to-peer, culturally sensitive, individualized, and interactive.
Thank you. And Teresa or Paula?
I think developing a multidisciplinary approach to care, utilizing the resources to everything that you can find out there in the community, because there is a lot of resources out there that exist, and tapping those resources, like we said, and then this gives us the overall improvement in care that we see, that sustains like a stronger, healthier community, because at the end of the day, it's all about that stronger, healthier community.
And we say the same thing. It's the hands-on. The patient has to feel that you do, as Angie said, you understand where they are, but you're also out there giving them their care. You're screening them, and you're letting them know. You're going right to their doorstep. And we are actually implementing a program with a nurse specialist to actually take them grocery shopping, because it's hard when you're as a provider and you hear them say, well, I can't afford this. this. You're wanting me to eat this. I can't afford this. So we're actually going to be going into the grocery store with them. It's hands-on and not talking down to them. Where we do collaborate with so many universities, we actually now have a class through the University of Virginia on Appalachian culture. So they don't go in and don't talk down to our patients, because just because we've got our hillbilly accent, they're still very intelligent and they do understand what they're being told.
Well said.
Yes.
Well, yeah, not only are you changing lives on the individual and local level, you're also a laboratory where we're learning what is going to work in other rural and non-rural areas as well. And which leads into the next question, which is, what are the key elements of a best practice program? And I'm going to put Dr. Gupta back to work here. Can you comment on that?
Yeah, sure. Typically, as we are moving, I think it's been touched upon, is that as a public health issue, what we're talking about today, cardiovascular health, and the more recognition there is towards the social determinants of health, and the things that impact people's lives, we often have not recognized in some ways. In other ways, that's exactly what we used to do 100 years ago in communities. Which is, it's the air they breathe, the roads they travel on. It's we have enough data to show that people with like-mindedness tend to have more friends of like-mindedness with similar habits and sorts of those things. In a lot of ways, we're talking about the concept of disruptive innovation. It's just not simple innovation, but how do you create a disruptive innovation concept in public health systems? To have those programs, I think some of the elements are already mentioned here. I think community relationships is key to ensure that there's trust building and all that in the community. But at the same time, I think it's important to be evidence-based and data-driven into what we're doing. Make sure that outcomes are being measured and we're accountable for those outcomes. And along with flexibility that we've talked about, it's important also to be understanding that some of these wins don't happen overnight. It takes a long time. For example, we know losing 5% of somebody's weight, if you're 200 pounds, that's that's not a lot of weight. That's and losing that weight is going to help you then maintaining that weight, and that's maintaining weight in certain circumstances will help you more than gaining weight. So the idea that not everybody has to be a 130-pound person with a figure, that's, I think, important to understand. But at the same time, addressing the culture that, my grandma had this at age 18, and so did my mother, and I'm just going to have it. There's no way to. That fatalistic attitude is something also that can be addressed with, again, education, but in a way that it, like expressed here, does not look like that we're alienating people by perhaps in communicating in a different way.
Thank you. Dr. Gardner?
I would say what we've looked at is like having effective leadership from the top down. I mean, getting everybody involved. I mean, not only your practitioners, but your front office staff, to get everybody involved. Having trained providers, developing quality improvement guidelines, and like Dr. Gupta said, driven by data, and develop a case management team that coordinates the care of that patient is what we have found.
And the buy-in by the patient, to add that. We actually have the patient set goals with us, and we'll tell them, okay, you keep a diary of your blood pressures, and I have a phrase that if you bite it, you write it, because a lot of them will say, I don't eat anything. Well, you have to be eating something. So just if you bite it, write it, and that has really helped, and just telling them, let us know what your goals are. What do you want to do? Do you want to be able to walk further? Do you want to be able to play with your children of the evening? And that's why we do the hands-on approach, and it really helps. We also use the social media because, as Angie said, you'd be surprised because they do have access to cell phones. So any education we have, we actually put our bulletins out, we put algorithms out, we put diets out, we put recipes out on the social media, and they actually look at them. And it's just important, even reading the food labels, as we were talking earlier. Some patients do not know how, so that's how it's just really taking the buy-in and doing the individualized care and actually realizing and training your nurses, your staff, that these patients are individuals and we treat them as such.
Oh, that's important. Changing human behavior is very, very challenging, and I learned a lot in politics. You basically have to make somebody else think it's their idea, and that's what you're trying to do here in some ways. Any comments?
You hear some similarities between the two groups, and both are very, very successful, but you also hear the differences and the nuances, and again, as from a foundation standpoint, from the organizations that we've funded, one size doesn't fit all. I mean, what works in one place may not work in another place, and I think you're hearing a little bit of that theme here. And the key here around best practices is getting information out so that other organizations can take the information and assimilate it and say, is this something that we think would work in our community? Is this something that would be successful in our community? And I think that that's a critical piece, from our standpoint and looking across the country in various communities and various situations. So,
Thank you. Well, this is my favorite question, and this is directed not to our panel, but to our distinguished patients who are here today. And hopefully we can hear from those who have been affected exactly what's going on. The question is, tell us about your experience in this program and how has it changed you? And first is Mr. Grant, Edward Grant from West Virginia Health Right. Please stand up and
Well, thank
glad
you.
to have you here.
My name is Ed Grant. I'm happy to be here. AstraZeneca, thank you so much. Health Right, thank you so much. I appreciate it. To all the distinguished people here, I want to let you know that it has changed me being a patient here at Health Right. And I think I need to walk around so you can see, because I'm not shy. But I want you to look at my skin. You can take a look at my waist. You can take a look at me. I've changed. And Health Right is responsible for that. This program is responsible for that. And I'm indebted to all of you. I've also listened to the people up on the panel talk about the programs, and I'm happy for both programs. And I'm really surprised to know that about all of the people that were vying for this support, that Health Right received it. And they encouraged us to come to class so that we can learn, rather than to hang out at McDonald's as an old man sitting there drinking coffee. Well, I kind of hang out here at Health Right. And I've learned so much, believe me. I love to eat. I was eating the wrong foods. I was drinking the wrong beverages. And Health Right has turned that all around. And I won't bore you with my success at Health Right. I wanted you to see it. But above all, I realized that that's one of the reasons why I love the West Virginia people, because they show love. And see, love is the whole answer to everything. If there are some roadblocks that you need to get over, just think about our Christ and why he did what he did. It was because of love, not because I'm bad. I'm really bad. But he loved me anyway. And that's what you guys have made me feel. You've given that to me. Coming here at Health Right, you made me feel welcome. You supported me. All of the things that you guys gave, all of the things, they share back with us. They don't hold back without prejudice. They give it. They give it, and you can feel it. When you come to Health Right, you can feel it. From the time you get into the lobby there till you get to the back room or wherever you need to go, they're helping you. They're not judging you. They're loving you. They're supporting you. They're feeding you. They're giving you gas cards. They're giving you health cards. They're doing everything that they can do, and I love it. I absolutely love it. And I want to say once again to all you guys, to everybody. Thank you from the bottom of my heart.
Well said. I think he's got a burgeoning career as a motivational speaker. It's fantastic.
I actually was taking notes as you were speaking, so I wrote down your quote on love. It was very beautiful.
Well, I don't want to let these other two individuals from Virginia out. And I think I forgot the names right. I hope Darlene Nixon and Pauline Radcliffe, who have some, hopefully, a brief story to tell us about St. Mary's Health Wagon.
I'll have to talk because Darlene's the shy twin. So our journey started a couple years ago. We had a sister that had fatty liver. She was very overweight, and it turned into cirrhosis, and she died at 58 years old. So we was in the same situation. So we contacted Teresa and Paula and asked them to help us. And they helped us. They gave us the diet, told us to walk. I was on oxygen for 2 years, confined to the house. I could barely get out of the bed. I had back pain, leg pain. But they gave us the diet, and we followed it, and we started exercising. We've lost 100 pounds each. And our journey continues because we're still not at goal weight, but we're going to reach it this year. But we were both on massive doses of insulin. And we're off the insulin now, off the high blood pressure medicine. We can walk 6 miles a day now. We take a Tybo class 3 days a week. And so our health, they have saved our lives, literally, because we felt like we wasn't going to live very long. In fact, she's got rheumatoid arthritis. And she was paralyzed at one time and had to go into rehab to learn to walk again. And now she can walk 6 miles a day. So thanks to Teresa and Paula, they've saved our life.
We love you, girl.
And we love them for what they've done. And our brother-in-law got laid off on the mines a couple of months ago and lost his insurance. So he was having chest pain. He went to Teresa. So she did tests on him, started him on blood pressure medicine. Well, last week he had 4 heart stents put in. If he hadn't saw her, we think he might not have made it because he was in really bad shape.
He's 51 years old.
51 years old. So they have really made an impact on a lot of people's lives in our county. So thank you, girls.
And these two have made an impact on us. The tables have turned. They tell us to come and exercise. And I told them this morning, now when you all go, you take me walking with you.
Thank you.
They call me, that because it's so hard to get out of the clinic, but they will call me religiously Mondays, Tuesdays, and Thursdays at 4:45 and say, it's 4:45, you need to be at exercise at 5, and they bring me a bottle of water. They are awesome.
And they didn't tell Teresa it was Tybo in the beginning because they was afraid she wouldn't go.
Thank you so much for sharing your stories and for coming up all this way to Charleston. I think there's a little competition among you two, too, as well. And I bet you've got some new wardrobes. Gosh, it's fantastic. The last question I'm going to ask of the panel is maybe putting some of this together from the beginning of the program to where we go forward is looking forward. How will you learn from your partnership with AstraZeneca Healthcare Foundation in order to grow and sustain your program? And Angie?
Yeah, I mean, it's just amazing what AstraZeneca Healthcare Foundation has done for us. I mean, we're a free and charitable clinic. I know we go, we live basically paycheck to paycheck, basically grant to grant. And what it has given us is a platform to try new and innovative ideas, give us the funding to do that, do things like the gas cards, the bus passes, things that we normally would not have in our budget that have made a total impact in patient attendance and in our patients' lives. So then it gives us a platform, and now we have results. We have positive results that we can share. And then it's easier for community partners and other grantees to come on board and say, wow, that program works. It's hard initially to get funding for something that you don't know if it's going to work. But they've given us the platform to prove, yes, this does work. And then, like I mentioned, the Teaching Kitchen, the Rotary Club and different people coming on board. So without them, none of this would be possible.
Thank you.
And I just have to add to that the AstraZeneca Healthcare Foundation, they provide such exceptional leadership, and they help us with our programs, and they are so committed, and just my hat's off to Joyce Jacobson, who works with us all the time. She's just phenomenal.
We actually said when we came back that we felt like we were at a family reunion because we get to see people we haven't seen. But as Teresa said, being able to have that platform, as Angie was speaking about, and the leadership, that making sure that we're checking those goals and providing guidance for performance evaluation, we've actually learned from that. And this AstraZeneca grant has actually impacted our whole community because people see what we're doing, and we actually have other healthcare systems calling us and saying, now, what are you all doing here and what are you doing there? And not only have you saved lives and increased awareness of cardiac disease, it's actually impacted the whole community and has actually expanded our efforts as we actually had a cardiologist, a retired cardiologist, Dr. Turner, that came and volunteered with us Monday.
We can get beautiful retinal images free of charge to the patients, and because that's the one place in the eye where you can see the blood vessels. I mean, the human blood vessels is in the eye, and so if they've got damage in the eye, then there's other, microvascular and macrovascular changes going on in the body as well. So, that's attracted that program. So with the help of the AstraZeneca Healthcare Foundation, it actually, creates synergy to bring in additional resources, and it just keeps on expanding for us. So we're so grateful because the AstraZeneca Healthcare Foundation, it's saving lives in our clinic. I can promise you on a daily basis.
I can see the enthusiasm. It just
Yeah.
exudes.
I would agree. We actually were able to get a telehealth retinal camera through CAMC Healthcare Foundation and Partners in Health. Even though you're thinking, well, you're not really remote, to get the care in here every day, sometimes it is remote when you're looking at, eye exams. We've actually been able to partner with the ophthalmologist at CAMC that they just recently came on board, and they're coming here 3 days a week. So when you have good results, when the media picks it up, you see it on Twitter, Facebook, et cetera, it does draw attention to your program, and more people, you see something successful, you want to join in. So it really works well.
Great. Thank you. Dr. Rosello, any
Well, I mean,
comments on
it's
that
so
partnership?
heartwarming for me and for our organization to hear, first off, the patient success stories, but also, the vision when we kicked this program off was, our mission was to improve cardiovascular health in the United States, and our vision was just to see these programs go out, utilize the grant awards to put together an innovative approach that works in their communities, and these two groups here are just phenomenal success stories and how it's done, how to utilize the funds, but to use as a springboard for other future work that you're doing, and again that's a testimonial to the great work that you guys are doing, and we're very, very, very thankful that we've that we were able to fund both of your organizations, and again, to see the success stories, it's just phenomenal.
Let me add one more thing. I just looked at Ann Hire. She's my deputy director here. Something that I haven't really mentioned is the importance of my staff, our staffs. I mean, it's great to sit up there at the desk and have all these plans, but if you don't have boots on the ground, your staff, they're going to buy in, take it to heart, actually roll it out, get the people involved, be energetic. It's not going to work. So I do have, the best staff around. They're great. Ann's great. She's great. She helps on the grants. All the way down, kudos to my staff. They're all dedicated. Nobody stays employed at HealthRight that's not dedicated to the mission and doesn't really have a heart for patients. And then we have the patients that show that.
True, it's true. It indeed is a family, I'm sure, in both places, for sure. We have a couple of minutes. If there are any one or two burning questions out there from the audience with this amalgam of information that's sitting up here, you can take your shot. If not, okay.
Thank
You said you weren't shy.
I've got one. I want to know how to volunteer. How can I give back? Charity begins at home and spreads abroad. That's how I was taught as a child. And I want to be able to give something back. How do you go about doing that? What can I do?
Well, you did it today. We need you to, actually, that's what I mean. We want to recruit you for the peer-to-peer part. You know, you've got up today, you said this is successful, so I want to make sure we get his name and get him added to the, we want you to get up and talk class. I mean, we can say it all day long, but if it's somebody in the trenches that's been there and is successful, that's who we want, you know, at the forefront.
And if I could add Angie, he does that anyway. He's just
Yeah. Well, then you're already doing it.
he is out there just a cheerleader.
And
Yeah.
we will leave our business cards, and if you want to move to Virginia, we've got plenty of opportunities for you.
Well, I have one,
He's not volunteering.
See, you are.
I have one today if you want to help me load the kitchen here in a minute.
Well, thank you all. I can see everybody's having a good time, but it has also been an incredibly informative and also inspiring to me to hear some of this I knew, other aspects of it I didn't know, and to see these products of all that hard work and collaboration with these wonderful funders. It's heartwarming to me. So I appreciate being part of this, and hopefully we'll get to see this happen again in the future. Now I want to give the last word to Dr. Basetto, and thank him again for all his hard work here, and I'm sure around the country. Thank you.
Thank you very much. Well, just to close this off, so first off, thank you for great moderation, but thank the panel for your active and tremendous participation. I mean, the purpose of this roundtable and other roundtables that we're doing is really to get the word out. You know, what are things that are working, you know, for your group? Why are you guys so successful? Because, again, if we can spread the information out there and get it out beyond, you know, just the participants that you have or the community within here, then that makes this even more impactful from our standpoint that we can share ideas. Not everything that works for you may work for someone else, but at least to have access to that information and what you guys have shared today is just, you know, tremendous. You know, the second thing and the most important thing is continue to do the great work that you're doing. I mean, you know, we're so thankful and happy to have funded these programs, and, you know, it is just, like I said, heartwarming to see the impact at a participant level, at a patient level, and the great work, and we're seeing it at a broader scale and a larger scale when we look at the results, but you guys are doing tremendous work, and it's always, you know, I can speak for the whole board, and I can speak, you know, for Dr. Newby and the other members of the board. You know, we're tremendously proud of the work you're doing with our funding, and we look forward to things, you know, moving forward and great stuff this year from your programs continuing. So I want to thank the audience here. I want to thank all our distinguished guests. Certainly thank our patients for making the trip up here, and you know, with that, I think I'll just conclude this and again say thank you to everyone here, and it's been a great interaction.